Let us see. Well, hold on one sec. Let me make sure. I've done this before where I have forgotten to take everything. I use multiple screens, so I've had it before where you don't take everything else off of your screen in time, you know. So hold on one sec. Let me make sure. I think it all looks good. Yes, absolutely. Uh, Very good. Oh, and I have to say, I love your ohia behind you, Charnel. That is
Thank you.
beautiful. That is lovely. Oh,
Thank you. Thank you. We see your home
yeah.
desktop, just FYI. It looks really
Okie doke.
organized, actually. There we
Oh,
go.
you're very kind. I
And
don't
now
know
we
about
see your
that.
slides now.
All right, perfect. That's great. I'm gonna, on my side, my presentation's on the other
Yeah.
side. So hold on, high, and let's do this. Let us swap. All right. Very
Perfect.
good.
Thank you.
Thank thank you. Well, now I kind of feel like I I appreciate that icebreaker you had. And number one, thank you so much for having me today. It's so nice to be back. Um, your group is just always wonderful to be with, and I really love talking stories with the community. And I truly do feel like we're just talking stories, you know. So, um, thank you so much for having me. I appreciate that. No matter what, as I was going through these slides, and I have to have a disclaimer here. I have another disclaimer I'm going to show you, but my disclaimer here is no joke. I sent these over to Shar yesterday, and the slides over to Shar, and I was still twiddling with them, and uh, I was I was doing that late into the wee hours in the morning, and my computer got a virus. No joke. It got a virus last night. It was making all kinds of sounds to me and
Oh,
everything. And then, remarkably, after an hour and a half or so it came back on, but it erased everything I had worked on. So, with that in mind, there's a few slides that I do still need to update on this, but and I realized how I'm probably not going to get to all the slides. I'm going to get through as much as I can, and that wonderful icebreaker that you guys just had is really helpful for me to see kind of like where people's interest is and stuff. Because this is a huge topic. There's such a large amount of information, and I certainly don't have all of it, but where I would like to be able to answer your guys' questions for sure. So here is my other disclaimer in the black and white here that I did write my affiliations, well, a couple of them that, but I'm not representing anybody today. I just wanted to come and give information, um, on the side of what I do and in my main roles. We do offer this at the clinic where I'm the medical director and also in my private practice clinic. We're not offering medical cannabis evaluations quite yet at the behavioral health clinic that we just opened at the School of Nursing and Dental Hygiene, which is that partnership with University Health Partners. But so let me just read this part where I'm not representing any dispensary. I'm not a dispensary. That's one of the biggest misconceptions for folks that do medical cannabis evaluations, that we actually have product with us. We don't have any product with us, not at all. We are simply evaluating. And by the way, it doesn't have to be quote unquote a medical cannabis um, evaluation clinic. In fact, I think the best placement is in folks' primary care or behavioral health care clinics that they run, where this just can be another treatment modality that may be considered when appropriate for a particular patient. Um, and it's certainly not for everybody. But for some folks, I gotta say, I will just start with the anecdotal first. For some folks, it has been very helpful for them. Up until very recently, on the behavioral health side of stuff, since we're talking behavioral health today, PTSD was the only DSM classification that was approved for medical cannabis when somebody has that, and doesn't automatically mean somebody can have medical cannabis. It's that somebody's condition can be certified if it is appropriate for them. Um, at any rate, before I get too far into all of, I was going to say too far into the weeds. That's my little joke for the day. As my kids would tell me, that's a dad joke, you know. But right. So I'm not representing any dispensary or particular organization for this. I'm not promoting anything or the department, and I'm not a representative of the Department of Health's medical cannabis program or receiving any incentives. Just wanting to let you know wanted to share with you guys and be able to answer questions that you guys have about the program, where there's questions. And if we don't get through it all, I'm happy to either email responses to those questions or happy to come back always too. But you may have info overload today and you're like, no, this is it for this is it for Dr. Beat. No need any rate. But I'm happy to talk more stories about it for sure. There is so much information, there really is. So let us see, and I'll try my best. Oh, hold on. Link to, oh, thank you. I just saw the in the chat about the link to the presentation form. Thank you so much. And I did make a couple of changes, and I'll give that updated um, presentation to Shar afterwards. But just for a little bit of background on this, I wanted to go through just the background because I wasn't quite sure where everybody had their focus of questions. We can certainly talk more stories about the program here in Hawaii, some of um, the the modes or ways that we would use this in treatment. But just for a background here, that cannabis, of course, was cultivated for many a millennia for many purposes: clothing, rope, paper, oil, food, medicine, and of course, famously, inebriation. um, Possibly cultivated longer than any other plant. There's some folks that think that there's probably other plants that were cultivated before, but I did want to put there that there is a sentiment out there by some folks out there that are like, this has been around for longer than anything else. 10,000-year-old cannabis flower, just as an example, was found in clay pots. And then fast forward to today, where we're using it medicinally in the US until the Marijuana Tax Act of 1937, where it was banned. Prior to that, it was very very cultivated, very used for all kinds of things. And I'm going to give you a couple of links to videos if you guys are interested in checking it out for sure. But we first had prohibition, the prohibition, and here is a old old flick, a segment of an old flick, Reefer Madness, that kind of built this stigma about it, what cannabis can do. And again, I do want to say, I mean, it's not for everybody for sure. Um, but for certain people, it's really been very helpful. I do have clients that have tried other uh, medications that may have PTSD and other ailments too. They perhaps they're uh, dealing with and grappling with cancer and the effects from the treatments for cancer and whatnot. Certainly was the case for my nephew, who lives here, by the way, but he had uh, uh, Barrett's. I'm sorry, I had to pause for a minute. Barrett's lymphoma, and he to this day he that helped him through while he was getting his cancer treatments as far as being able to eat again and whatnot. And to this day, it helps settle his stomach. So he had a huge ulcer in his stomach, and he had a lot of work done there. And it's pretty remarkable the effects that medical cannabis can have for him to allow him to eat still to this day after all of the surgery that he's had in his abdominal section and everything. So have seen firsthand how effective has been with him. I have quite a bit of patients too that I have seen through the years that um, they are now grappling with PTSD and other ailments, but also had cancer, and it's really helped, and many other things as well. ALS uh, has helped with that. Of course, there's a lot of research out there too with seizure. Anyway, I'm getting ahead of myself. Now I feel like if you've ever come before while I was talking, I feel bad for everybody because I know, you know now that I can kind of veer off. I get all passionate about things while I'm talking. So thank you for bearing with. I really appreciate it. Um, so just some information about here about um, the how it came to be that medical cannabis, well, I shouldn't say cannabis, but marijuana back then, and that this term, by the way, you hear me say cannabis, um, it actually we have stuck away, and I'm really proud, not kind of, but really proud of our Department of Health and our medical cannabis program here, which they do a tremendous job, by the way, the folks over at our Department of Health's medical cannabis registry program. That they're very supportive, very helpful, and um, they've in the beginning it was called the Medical Marijuana Registry Program, but have changed it to the Medical Cannabis Program registry program, and I'm proud of them for that. As it carries with it some stigma to it. Marijuana, the name marijuana, there's a whole history to that too, during the prohibition and everything. So, um, any rate. We are talking about the same thing. If I'm talking about cannabis or you hear marijuana, it may come out of my mouth as well. I grew up here as well. It's very common to hear marijuana still yet, but we're talking about the plant. If we're talking about cannabis, we're talking about the plant. Um, just a little bit more history here too. American Medical Association's Medical Council, during this time when it was going through that prohibition period, um, uh, the medical counsel, sorry, Dr. Woodward, objected to prohibition, stating that there were potentialities that shouldn't be ignored. In 1942, the AMA, the American Medical Association, fought to keep it part of the U.S. Pharmacopedia, but was to no avail. There was tremendous political pressures. I'm not going to get too far into it. Happy to talk more about it or check out the links that I shared. But um, the whole uh, politics behind it, it's really interesting if you start looking at how it became criminalized. Um, very, very interesting. So there was the Controlled Substance Act. Oh, and stop me anytime. I know I'm not tracking the cotton industry squashed it. Oh, thank you, Dr. Cohn. I appreciate it. Yeah, there's yeah, what a history. Holy camoles. I think we're coming out of it. I hope so, for sure, because it can be useful for certain folks. So there was the Controlled Substance Act in 1970. It was considered a Schedule One substance, and just a little background on what the schedules are. So, um, our our drug enforcement agency, the FDA, also, so we have a schedule of drugs that are at risk of being um, becoming addicted to, or having harm. And so there's five schedules. The first schedule is a drug or a substance, rather, that is considered to have no therapeutic effect at all, and very risky for substance use and abuse and becoming addicted to things. So, Schedule One is like, there's nothing for this. And just to put this a little bit into perspective, and it always kind of amazes me, did you know that cocaine is a Schedule Two medication, as is methamphetamine. Yes, you heard that right. Methamphetamine, which actually can be prescribed. I've never known anybody who's prescribed it. I've never prescribed it either, but methamphetamine can be prescribed for certain things like ADHD. And again, that is not the foremost treatment nowadays, but it's still there in the Schedule 2 versus the Schedule 1, which has medical cannabis, which always kind of boggles my mind. And here's one of the reasons why I'm not going to say I'm, I'm not presenting on behalf of anybody, but it just boggles my mind, kind of like we have medical cannabis, and there was some other things that, um, you know, that we know can help, for sure. So, a DEA interpretive rule published in 2001 states that the definition of marijuana was intended to include, and that's quote unquote, that's why I didn't put it as cannabis, was intended to include those parts of marijuana which contain THC, and to exclude those parts which do not. So this next thing here that I'm stating, cannabidiol. If you have heard CBD, CBD, it's available online. You can find it in health food stores. Um, you know, uh, that's that's actually, we're getting into a different territory. If the CBD, I'm sorry, which is one of the cannabinoids in the cannabis plant, just one out of the over 100 cannabinoids, which, like THC, is a cannabinoid, one of the hundreds in 100 plus in the cannabis plant. um, THC is what is criminalized. So, at any rate, cannabidiol, which is CBD again, is not included in the Schedule 1 when the Controlled Substances Act was amended in July 2012, with the U.S. Congress passing of the Synthetic Drug Abuse Prevention Act of 2012. Marijuana has a DEA drug code. You don't need to memorize this. I promise I won't give you a quiz at the end. I saw that there is a chat. Hold on one sec. Wasn't meth designed to help military? Oh, yeah. You know, you are Janina. I hope I'm saying your name right. Please forgive me if I'm pronouncing your name wrong as I see those chats, but there was a question that came up on the chat, but about wasn't meth designed to help military pilots stay awake? Interesting. Um, there is a background to a lot of medications nowadays that was used for the military, like And this is a whole nother lecture that uh, ketamine, which is really one of those, the newer, well, it's been around since 70s, but it's one of the newer treatment modalities for treatment-resistant depression. Also has been used for anxiety and PTSD as well. So yeah, there's a history for a lot of medications. Some of these like cutting edge kind of treatment kind of stuff that where they've been used, and our military has been on the forefront of a lot of them too.
They get
Um,
everything. They get every vaccine, they get everything first, and they don't know what they're getting. Um,
yes,
yeah,
yes. Oh,
it's
you're so
really kind of scary. But
yes.
there's a question from Leah about more about the difference between CBD and THC, and
Okay.
it's a good question.
Yeah, it's a really good question. Um, Truly a great question. So, yes, there's a really big difference. So, THC, and again, there's more than 100. Unfortunately, I put all of that kind of information towards the end of the presentation. So, thank you for bearing with, and thank you for asking the question because I can gear this more towards however, the interest level is for folks, because again, there's so much. So back to the back to the question with THC, which is just one of the over 100 cannabinoids in the cannabis plant. CBD is a non-psychoactive component. And it's probably, I'd like to say it's equally, if not more, researched even than the THC portion. But don't quote me on that one as far as like how much research on each particular one. But CBD is readily available, and it's not federally illegal. And it has to do with how much THC content is in whatever product somebody is selling that is labeled as CBD. You can find some products online. Uh, Be careful. Just be careful. Please do your due diligence. There are some products online where it has been shown that they have higher content of THC than is allowed, and this kind of stuff, or what they state. But THC is the psychoactive cannabinoid, that component in the cannabis plant um, that will cause the psychoactive feeling. Uh, that feeling of quote unquote somebody feeling high, they're if they feel disassociating, um, these kinds of feelings, which if anybody has experimented in high school, or whatnot, that 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 feeling of getting high, otherworldliness, whatever, that psychoactive component, that's the THC talking there. It does work in conjunction with the other cannabinoids, though, and even to get it more complicated, there's terpenes as well. There's terpenes in all of in our plants that around, not just the cannabis plant, but so CBD, non-psychoactive. And I typically, when I'm working with somebody, I may recommend CBD, giving CBD a try if they're into natural remedies and whatnot. There's a lot of research out there how CBD can be helpful for folks that are having um, seizures. It can be helpful for anxiety as well, a sense of calmness. Um, CBD can also be helpful for um, bringing down inflammation, these kinds of things. Now, before you go out and just order all the CBD you can get, because it's not psychoactive per se, um, our bodies have an endocannabinoid system. within us. This was just recently discovered. I mean, we have an endocannabinoid system within us. And so, with that said, anytime you make endo anything, and when I say endo, so endocannabinoids, so that's us making things inside us. Whenever you make any of this within you and you are supplementing with an outside source, one thing I want to talk about with everybody is just be aware, like you're making this already, and if you're supplementing with an outside source of whatever it may be, uh, that our bodies, in its infinite wisdom, can start to make less of that substance, or the receptors will not be as open to our own making of it. And I'm not knocking, you know what? I'm not knocking one way or the other. I'm just saying these are the kind of things that like I like to talk about with folks if um, folks are taking supplements for substance that we make ourselves, like another example, melatonin. We make our own melatonin. And by the way, serotonin is a precursor to melatonin. And if we supplement, anyway, I'm getting on a
Well,
tangent on that.
actually, on that note,
Yes.
Dr. Cohn says that he understands they finally discovered that acetaminophen acts at endocannabinoid receptors. Had you heard that?
Oh,
I didn't know. No wonder
oh,
I love Tylenol so much.
oh, yes. And you're not only talking Tylenol with codeine, you know what
No,
I
just
mean?
straight
Yes.
out.
Straight out. Yes, absolutely. Yeah. And there's other things that can tickle our endocannabinoid receptors and everything. Our body, we are a walking pharmacy, but we're like the most ultimate pharmacy you can you can walk into, and it's in us. You know what I mean? Yeah, thank you so much for sharing. I super appreciate it for sure. Oh, I got trigger happy here. I get all excited about these things. Uh, let's see here. Oh yeah, I touched on that third bullet point down. And what we talked about actually this whole page. Hold on. Let's go to the next. 1996, California was the first state with a medical cannabis proposition. They're they're the first to a lot of that West Coast, I tell you. They're the first for a lot of things, actually. Act 228 was Hawaii's initial medical cannabis use law signed by Governor Cayetano. I remember that in June 2000. And we are the first state in the nation, so we can be proud to permit medical cannabis via a state legislative act. Sixth state in the nation to legalize some form of medical cannabis. And the program was originally through the Department of Public Safety. Now, though, since 2005, our of Health operates this program, and like I said, they have done a tremendous job. Um, there's a whole certification that program. I say program, but it's a um, online program. We have to go through a training that before you can, and it's not prescribing cannabis. Oh, that's another thing. I'll bring that up in just a sec too. But we're certifying conditions, like we're certifying that medical cannabis, this recently changed too. This is the stuff I have towards the end of the presentation. So I'm going to bring it up here because I'm probably not going to get to those slides, but because it is interesting. So we are not prescribing cannabis. Like a regular prescription pad, or we're not calling it in or anything like that. We're certifying um, that this person has one of the approved conditions for meta for a client to be part of the medical cannabis registry. That's their official name, Medical Cannabis Registry Program. You can Google it. Oh, they have a ton of information, by the way. They're so helpful, and you can get on their email list, and they'll send you updates and free trainings and all this kind of stuff too. But so we're certifying that condition. It was just recent at this past legislative session. It was just passed, not into, and I need to double check. This is one of the things I wanted to double check for you guys. Up until this last passage, there were certain set conditions that were approved for somebody to be certified, to have a certified condition that is approved for the medical cannabis registry program in Hawaii. Um, but that has now, with this last legislative session, changed to where a prescriber may be able, which would be either a physician or an advanced practice registered nurse with prescriptive authority, um, will be able to say this patient has a condition in, that without saying one of these prescribed conditions, has a condition where the benefit may outweigh the risk. And oh, yes, we talk a lot for sure in depth about risks and benefits, as we would with any other medication that we prescribe. There's all kinds of risks and benefits for sure with medications. And by the way, for any over-the-counter medication, there is always a risk. That's why you have all the warnings on the back of any medication. So it's important to go through all of these. And again, particularly for somebody who has not used medical cannabis. I have folks that may be going through their cancer treatment or ALS in their elder years, and they've never used before. For these kinds of folks, I will, after assessing somebody, a great start is something like CBD, as the wonderful question that somebody had asked previously, the difference, talk a little bit about the difference between CBD and THC. And I'm not doing it justice here. I know I could spend we could spend the whole hour just talking about that difference, but that's a great starting point for somebody. If what somebody is grappling with may benefit from CBD versus the THC. Um, at any rate, what was I here when I went on that tangent? Oh yes, Department of Health. I was just giving them props because they do a lot of great work. They're so efficient now too. I've been doing medical cannabis evaluations. Just it's not my primary thing that I do, but if I have a client where that looks appropriate for them, as part of their treatment. It won't be a separate, it's not a separate thing that I do with them. It's just part of their total um, wellness treatment regimen that we may consider. But yeah, again, Department of Health, they've been really great to work with. They're very quick at it. In the beginning, I just have to say, when the dispensaries, the current round of dispensaries opened up in late 2016, um, it was taking like 3 weeks to a month to get medical cannabis application registry applications approved through the Department of Health. Um, and they did still have a online software platform that we use to do this, uh, but it took a little bit of time. But they've gotten so efficient. it's pretty much the next day, and they do prioritize now too. So if somebody is suffering through cancer, cancer treatments, that would be prioritized before, let's say, and this is not minimizing somebody with pain, but say somebody is using medical cannabis for their pain, the somebody who is experiencing terminal illness would be prioritized as far as going through that application. It's it, currently it everybody's being approved very fast, but they recognize that it was taking a long time for some people, as so many things, in the quote unquote system, you know, um, for things to go through. But at any rate, they're very quick, very helpful now. They send out a whole bunch of information. Anybody who wants to Google them will have a ton more information that I'm sharing with you today too. But here's kind of an update. Well, let me hide my floating meeting control. Always getting in my way. Um, so our current, and I was just updating this every year. I give a lecture out to my students, and I've done this, talked about this in the community before. So I update this, and I was just updating it, and every year there's more. Floored how many more states are have medical cannabis programs or recreational adult use. So medical cannabis program, that's what we have in our state is a medical cannabis program where somebody has a condition where uh, a prescriber may uh, find after working with your client again too. This is not, I've never been like, you should do medical, I'm never ever pushing any of this on anybody. This is something to be discussed with our clients when appropriate, for sure. But so 40 states plus Washington, D.C. have a medical cannabis program. Recreational adult use. Now, recreational means like you're an adult, you can get it, you can use medical cannabis. States differ as far as if they offer dispensaries. You'll hear folks going to Vegas, where they have dispensaries, and California have a very robust system of dispensaries over there. Our dispensaries here on the island, we have three organizations. And again, this information's on the tail end of the presentation if you want to check it out. And it does need to be updated too. That's some of what I lost when my computer had the virus last night. Oh
Your
my
ghost
goodness.
in the machine.
It was the ghost in the
It's the
machine.
ghost
Oh
in the
my,
machine.
yes. I mean, I took a video of it actually because it was making sounds at me and everything. It was terrible. At any rate, yes, it was the ghost in the machine for
Well,
sure.
so this is Dr. Weir mentioned this before. Why should a patient have to go through all this work when it's recreationally available, in 24 out of the 40 states in DC? So that is kind of crazy, but not here.
Yes, it's not here. It's not available recreationally here. And that's a great point and topic to bring up, even in the states where recreational adult use cannabis is allowed. Um, because they have medical cannabis programs too. And then that question that was just posed, what a great question, because why would somebody then go through all the hassle of going to, because they still have these the medical cannabis certification places and stuff in the states where they may have recreational cannabis. So they try to generally offset that with, and every state is different. This is our we're a republic here in our in our country, where states can, as we know for sure, especially in this current political climate where there's different laws in every state. But most states, even when they have recreational adult use, have a medical cannabis program, and there's usually some tax incentives, like maybe they don't have, they're not taxed on the at that dispensary when it's medical cannabis versus being taxed maybe more heavy at going through a regular adult dispensary where you're 18, you can get in and you can get cannabis. And some of those dispensaries, so if you hear the term dispensary, that's where folks go to get the product. Um, and I'm going to pull it back to, I know I'm kind of veering back and forth here. There's so much information, so thank you so much for bearing with. But um, so here in our state, we only have on our island, Oahu, we only have three dispensary companies that were approved to be dispensaries where you can get the medical cannabis product. And they have to grow each of those dispensary companies. We have Cure Oahu, we have Aloha Green, and we have, oh my good Lord, I'm so sorry. I'm going to sound terrible now. Aloha Green, Cure, and oh my gosh, I'm being terrible. Now I have to Google myself. Uh, any rate, but we have three
I'll,
companies.
I'll Google for you. You keep talking.
Oh, thank you so much, Dr. Withy. This is my brain on very little sleep, so thank you for bearing with.
We've got
Um,
Oahu Dispensary and Provisions, Oahu Dispensary, Noah Botanicals.
Noah Botanicals. Yes, thank you so much. Thank you so much. I really appreciate it. Yes, and each of those dispensaries, by the way, have three locations on island, but there were only three on our island, three companies on our island, and there are additional two for each of those, so nine total, um, where you can go and get the product. Uh, Legally in our state, um, they have to make their own. They can't share amongst themselves. They don't have growers outside of the dispensary that they can buy from and import. So if you go to one of the dispensaries, they have grown all of that themselves. It is all lab tested, and this is one of the other benefits of the medical cannabis registry program. And I think it's a huge benefit. Honest to goodness, I'm hugely in for this is just me. And I don't mean to push it on anybody, but I'm all for harm reduction for sure. Personally, where if somebody is going to get it from on the street, um, and you don't know we're living in this day and age with what's being laced, what kind of pesticides are being used, all of this kind of stuff, and you're inhaling this stuff or ingesting this stuff. Um, wouldn't you feel more comfortable if it was all lab tested? Like it's certified lab tested for um, any other substances in it, and it will label. They're getting into labeling more of the cannabinoids, but for sure it will label how much THC is in something. Generally, how much. There's also, by the way, something called THCA, just to get complicated. And then CBD. They usually do those three. For sure, THC, though, as well as CBD, that they'll have the amounts because we all know there's different amounts in everything you get versus something you get on the street. You don't know how potent that thing may be. It's really important, especially if you're using this as a part of somebody's whole health treatment regimen for them. what is their tolerance to it? What is their tolerance to THC? Did you know there are strains, we call them strains, from the so you have medical cannabis and you have different types of strains. This is where you'll hear all those funky monkey names. You know, Gorilla Glue or Donny Burger or Blue Horizon, all kinds of medical these strains, but they will list in that batch how much THC is in there. So it's really important to work closely, though we're not prescribing per se prescribing the medical cannabis. We are certifying condition, but we sure want to give as much information that we can to our clients and really assess how how new is this for them? Is this a new thing? If someone new to cannabis again, like I'll be wary of just like you don't want to jump off with somebody having a very high dose of THC that will cause all kinds of anxiety for folks if they're not okay with that experience, because there can be that disassociative experience and whatnot um, that happens. Be careful. Yes. So anyway, I'm a fan of having a dispensary. I'm a fan for sure of having the lab testing. Absolutely, especially when you're using it for a treatment regimen. Um, can I also, I'm just looked at the glanced at the time and I really did talk way too much already. I'm so sorry, but if I could just share,
Are you halfway through your presentation?
no.
Are you available next Tuesday?
You know what? I'm not next. So, you know, these hours that
Mm,
we have the presentation, these are like the primary hours for
I'm,
the clinic that we started
oh,
with the
shucks.
nursing department. But I certainly can with enough weeks notice, I certainly can put it on there. I'm so sorry that it
No,
not
no,
for
that's
next.
okay because this is um, very interesting and I can tell people are engaged. And so we don't want to cut you off. So
Oh,
maybe
you're
talk
so
to Shar
sweet.
about when you could finish this up.
Okay. Oh, I would always be happy. I'm always honored when you guys have me. I love talking stories with you guys for
You're a
sure.
busy,
Uh,
busy man. Don't worry, we have
oh,
over in November. We'll give you enough time.
oh, that's perfect. That's wonderful. Thank you so much, Shar. I really appreciate it, Dr. Withy. Thank you so much. But
I don't think we have any cases today. So go on for a few minutes and then next week is a surprise talk. Uh,
oh, that's
it's a
exciting.
surprise even to Shar and I.
Oh, that's funny. The humor is wonderful. And humor, by the way, is evidence-based practice for sure.
It is.
It really
Humor,
is.
prayer, meditation,
Yes.
all good for you.
I completely agree. 100%. Yes. So if so the thing I wanted to share with you guys, just as a, you know, one of the parting thoughts is, if you are new to cannabis or you know somebody who's new to cannabis, I would beware of some of those, like be sure you get it from a reputable source. So again, I'm a big fan of the dispensaries. Um, in our state, again, it has to be a, you know, medical cannabis registry card, but uh, a frequent amount of milligrams for THC for oral something, an oral um, gummy or oral whatever you're taking it on, cookie, whatever it may be, is 10 milligrams. Be careful. That's too much if you're just starting. Truly, go take it low and go slow. That's the motto, isn't it? Low,
In
go.
geriatrics, but now in marijuana too. So
Yes,
yeah,
yes,
it,
it truly is.
the
Uh,
pot that my dad grew, we never knew what the composition was, but I remember the paranoia. So,
Oh, yes. Yes, absolutely. We didn't even start talking about all that. I mean, this is where we got to be really careful with our kapuna, like kapuna, who are truly, they're suffering through some of the conditions that may warrant somebody having cannabis. But let's be careful. I have a few clients currently that have really pretty advanced ALS, and it's helping them. And I'm thinking of one person in general, right, in particular right now, who is a deer kapuna. But it, it is a real process, who has never used cannabis on a regular basis, to make sure the dose is good for her. And again, especially because I'm not prescribing it. This is not something you're going to go and get from the pharmacy. Um, this is all different amounts. And as you just shared, Dr. Withy, and thank you so much for sharing that. Like, you didn't know how much of THC there was, let alone any of the other cannabinoids in there as well. And there's certain strains, if you're in high school, and there's a party and somebody's throwing around a joint, not a G, a joint, you don't know how much is in there, and you're not really particularly, I never heard of the different strains, or whatever. I went to high school in Maui, so and grade school over here, so you would hear like, oh, Maui buds or whatever. But you don't talk about the strains, and truly the different kinds of strains can have different effects on different people. If you want to, before we meet, you can Google. There's all kinds of information out there as far as what kind of strains, what kind of terpenes, all these things that help with particular conditions or whatnot. But before you
so
go and yes,
yeah.
go ahead. I'm so
Oh no, I
sorry.
was just going to say,
We're
so
out
in
of time.
November, we'll talk
Yes.
more about the
Okay.
differences in different
Yes.
ones because yeah, um,
Yes. It
I
sounds
understand
good.
they're broad, I mean, there's all these different ones and yeah, I wouldn't even know
Yes.
what to say. It's like going into I guess it's like going into a Chinese medicine shop and saying, I have this and I need this and I get this way. I don't know. So I don't know.
Yes.
Yeah.
Yes. Yes. Absolutely. Yes. I'm sorry for going so long. Thank you
No,
for
no, it's
bearing. It's
perfect. It's
always it's
perfect.
always a joy to talk with you guys. I
Yes, and
appreciate.
you're so authentic. It's so fun to talk with you. I can see why patients
Oh.
really like seeing you. Um,
Oh, thank you. You're so kind.